Hi, my name is Siti Zulaika binti Jamaluddin. Today I want to talk about introduction cancer leukemia. Okay. Before that, my number ID is DHC 06222133. So today I want to talk about cancer leukemia. Cancer leukemia is a type of cancer that affect the blood and bone marrow, characteristic by the uncontrolled production of abnormal white blood cell. This malignant cell interfere with the normal function of the body immune system, leading to higher risk of infection, anemia, and bleeding. Leukemia can occur in both children and adults with different type depending on the specific kind of white blood cell affected and how quickly the disease progresses. So there are four main types of leukemia. One, acute lymphoblastic leukemia. It's about a fast-growing leukemia and primarily affect children. Number two, acute myeloid leukemia. It's about a fast-growing leukemia affecting both children and adults. Three, about chronic lymphocytic leukemia, a slow progressive leukemia that mainly affect adults. Number four, chronic myeloid leukemia, a slower form of leukemia usually effective for adults. Symptoms of leukemia include fatigue, fever, easy brushing or bleeding, frequency infection, and weight loss. The exact cause of leukemia is often unknown, but genetic mutation, environment factor, and certain life choice that contribute to its development. Early diagnosis and treatment are crucial for improving survival rates, with treatment options including chemotherapy, radiation therapy, stem cell transplants, and target therapies. In this presentation, we will explore the different types of leukemia, their causes, symptoms, and current treatment method. That's all for me. Thank you. Bye bye.
Hi, I'm Kalina Erika from batch 27B. My ID student DHC 062217. So I want to present about symptoms, causes, and factors of leukemia cancer. Symptoms of leukemia often develop suddenly over days or weeks. Leukemia symptoms can vary based on unique factors including the type of leukemia and the patient age and overall health. However, some of common signs or symptoms of leukemia can be seen or felt. The symptoms include high fever or chills, persistent fatigue, and easily tiring. The continuous infection and feeling lost appetite, making a person unintentional weight loss. They also always got excessive sweating, especially during nighttime. Leukemia symptoms also can be an increase of sensitivity to hot and cold temperature due to low red blood cell count. Leukemia also got visible symptoms such as a bone pain and tenderness, bleeding easily or skin rash known as alopecia. It is easy to tell someone has leukemia with these visible symptoms. For causes and factors of leukemia, the exact causes of leukemia is unknown, but it's thought to be a combination of genetic and environmental factors. Although experts are uncertain about the causes of leukemia, they have identified several risk factors that include exposure to high level of radiation, repeated exposure to certain chemicals such as benzene. Chemotherapy. Having received chemotherapy is linked to a higher risk of developing leukemia. There's also genetic disorders. Scientists have identified many genetic mutations in blood stem cells that can lead to a leukemia. A strong family history of leukemia. If a family member has previously been diagnosed with leukemia, one risk of developing leukemia is elevated when compared to overall populations. So that's it. Symptoms and causes and factors of leukemia from me. Thank you.
Assalamualaikum and very good day. My name is Haidar Rizwan bin Muhammad alias Muhammad Abdul Kiram, DHC 0622TH3. So I'm going to explain about how to treat leukemia. So the first, there are three types, which is the common methods, psychological support and care, and the last one is advances. Right now, I'm going to talk about the common method first. There are five that I identify, which is the first one is the chemotherapy, targeted therapy, radiation therapy, stem cell transplantation, and the last one is immunotherapy. So the first one, the chemotherapy, it is uses of strong drugs to kill leukemia cells or stop them from growing. It is the main treatment for acute leukemia and it is often used in cycles. The next one is targeted therapy. These drugs focus on specific molecules that help leukemia cells grow. And it is targeted therapy are more precise and have fewer side effects than the others. So the next one is radiotherapy, and it is the treatment use high energy rays, which is X-ray, to kill cancer cells or shrink the tumor. And the treatment used to target leukemia on a specific areas and like the spleen or lymphatic system. The fourth one is stem cell transplantation. This treatment replaces the patient unhealthy bone marrow with healthy stem cells from a donor. It's often used for high risk cases. So the last one, which is immunotherapy. Immunotherapy helps the body immune system fight the cancer. And one example is the CAR T-cell therapy, which is modify the patient immune cells to target leukemia cells more. Now we're going to talk about the psychology, support and care versus the advancements in treatment. So if you can see, the psychological support and care are more focused on mental health and managing the side effect, which is dealing with leukemia can be emotionally challenging. Support groups, counseling and stress management are important parts of the treatment process. And which is managing side effects, the treatment can cause side effects like fatigue or infection. Pediatric care focus on relieving these symptoms to improve the patient quality of life. And for the advances in treatment, more personalized medicine and new immunotherapies. So right now, thanks to the genetic research, doctors can now choose the best treatment based on the specific characteristic of a patient leukemia. And this makes treatment are more effective and reduces unnecessary side effects. And the new immunotherapies, innovative treatment like CAR T-cell therapy have shown great success in treating certain types of leukemia, especially in patients whose leukemia is resistant to other treatment.
Hi, my name is Enrika Natalia Anak Garrett and I'm going to talk about the history of leukemia and how the diagnosis of leukemia was determined.
The history of leukemia began in 1845 when leukemia was originally classified as a systemic condition. Fast forward to 19, leukemia was considered a multifactorial disease rather than a singular sickness. And in 1948, the first report of leukemia was published. Leukemia's history dates back to 19th century when scientists first identified uncommon blood cell disease. After Robert Hooke published the first important work on advanced biological science, Jan Swammerdam examined blood cells for the first time under a microscope in 1658. Anton, considered as the father of microbiology, first described human blood cells and blood flow in capillaries. Maurice, a cook in a Paris hospital back in 1833, noted a severe drop in blood during an autopsy of a female patient and recognized that his findings were identical to those of Velpeau, who published in 1825. Alfred Velpeau, chairman of the University of Paris back in 1833, submitted a case report with symptoms of abdominal enlargement, fever, weakness, urinary stones, and a changed blood mixture that resembled pus-filled blood. He eventually dubbed the disease leukemia for the first time, owing to a rise in white blood cell count. Moving on to the history of the leukemia's diagnosis. Alfred, in his article on leukemia, stated, "There are conditions in which white cells seem to be in excess in the blood." He thought the white cells was mixed with pus, but eventually in the end he was able to observe a clear-cut difference between these cells and the white cells. And for the first time, he discovered that leukemia is related to cells that are abnormal. Last but not least, in 1877, Paul described the primary findings of leukemia for the first time and provided a detailed description of the nucleus, cytoplasm, and other blood cells.
Hi, my name is Nuriana Akma, and today I will talk about the article that I choose, which is the title is Health-Related Quality of Life of Patient with Acute Myeloid Leukemia, a Systematic Literature Review by the author name is Ellen E. Corral. Introduction. What is AML, which is acute myeloid leukemia? a type of blood cancer affecting bone marrow and blood cell, requiring aggressive treatment like chemotherapy or stem cell transplant. Why health-related quality of life important? Is to measure patient well-being beyond survival rates, help assess an impact of AML and its treatment on daily life. So next, our objective of the study. The key aim is to identify and summarize health-related quality of life estimate in AML patients, including to relapse or refractory cases. Why is this study? Limited previous research on health-related quality of life in AML patients. We need for a better treatment approach with fewer negative effects on health-related quality of life. What is health-related quality of life? Is referred to the patient overall well-being considering their physical, mental, and social health, especially when dealing with disease like AML. Next, we move to the methodology. Here have a prisma diagram that explains systematic literature review SLR approach. Inclusion criteria is a study on AML patient aged 18 above, reported health-related quality of life using validated tools. We include relapse and refractory. So here have a table that explains symptom active treatment patient in AML survivor in percent. So most problematic symptom reported. Fatigue, most common across all patients. Pain, nausea, insomnia, appetite loss, and financial difficulty also impact health-related quality of life. So we move to the next part, which is health-related quality of life score over time. There's a table that explain measure before treatment, during treatment, and post-treatment. So we already get into our last part of our talk, which is conclusion and implication. First, after being diagnosed with AML, patients experience a significant decline in their quality of life. This affects not just their physical health, but also their emotional and social well-being. Second, fatigue remains a major issue even after treatment. Many patients continue to struggle with exhaustion, which affect their daily activities and overall recovery. Third, current treatment can be quite toxic, which further impact patient quality of life. So there is a strong need for less harmful treatment option that can still be effective while minimizing side effects. And finally, future research should focus on patients who experience relapse or those who AML is resistant to treatment. By understanding their challenge, we can work towards better solution and improve outcome for them.
About conclusion about leukemia. In my opinion, leukemia cancer is type of blood cancer that occur when the bone marrow produces abnormal white blood cells excessively. This disease interferes with the normal function of the blood and can cause symptoms such as fracture, pulmonary infection, abnormal bleeding, and easy breathing. Leukemia is divided into severe types including acute and chronic, as well as idiopathic and mild. Treatment depends on types and extent of the disease, with methods such as chemotherapy, target therapy, immunotherapy, and bone marrow transplantation. Although leukemia is a serious disease, advance in medicine has increased the survival rate of patients. Early diagnosis and appropriate treatment can help improve the patient's chance of recovery and quality of life. Early diagnosis and accurate treatment are important for the best result, as the saying goes, prevention is better than cure. Therefore, we should not take this thing granted. We should take the best awareness make sure. Thank you.